Today we are in Natinda. Pakistan Healthcare Foundation, they held one camp for a free medical checkup for every Ugandan in this country. Dr. Saab, Assalamu alaikum.
Walaikum salam.
Dr. Saab, today you are in one of the biggest platform in social media in Uganda for a foreigner people as well. How was your experience for this camp which you did it?
Bismillah Rahman Rahim. Ali Bhai, thank you so much. First of all, I will appreciate the Pakistani Association of Uganda under the elegant leadership of Sheikh Rashid Bhai and his team that this activity for the humanity was possible because of his and his team endless efforts. Really, I have no words to appreciate and thank them that these people are working day and night for the last 20-25 years in so many fields, whether it is food packages, whether it is health, whether it is help of poor people. And 3 days back, with the collaboration of Sudanese doctors, we had a camp here. Again, we provided space, we provided equipment, we provided staff of million shillings worth. But again, it was a gesture of love, and it was by the order of our Pakistani Association of Uganda, and of course, with the prayers and help of brothers like you people.
Okay.
Today again, we did the same camp. About more than 150 patients were seen.
Okay, Dr. Saab, I have one very important question. You know, for about the sugar, which I got to know that you people are too much focused on sugar patient in this country.
You mean diabetic?
Diabetes.
Yeah.
Ali Bhai, frankly speaking, in Uganda, diabetes is not so prevalent, but chronic infections like malaria, typhoid, and the other infectious diseases, they are more common than diabetes. But of course, diabetes is also an emerging disease of the high elite class and those people who are not doing exercises and who are eating day and night without prevention.
How many patient we are feeling? What is the percentage of diabetes in this country according
In
to you?
Uganda, the ratio is very less. In Pakistan, it is very high, but here I can say after
Acha,
every
Dr. Saab.
20 patients or after every 15 there will be one
Acha,
diabetes
Dr.
patient.
Saab, there is a very important question. Even if it is 20%, the way of treatment, do you think Pakistan and Uganda, they are in the same platform to treat the
No.
sugar patient?
No, I will really like to add that Uganda Health Ministry, doctors and the health sector needs a lot of improvement. They should import doctors from the highly developed countries like India, Pakistan and of course Europe. They don't have those facilities which we have, they don't have those medicines which we have and those machinery for investigations of the complications and of course treatment of complications of diabetes.
What's your plan to make this kind of camps in this country for a period like every 15 days, every month, every 6 months or every year?
Inshallah, the Pakistani Association of Uganda and the team, we have decided that we will expand and extend this opportunity and facility to each and every portion of this area. And of course, it's a teamwork. We need the help of local people also. We need the help of government of Uganda also. And we need the NGOs and health sector community to come forward and join hands with us.
Do you think you people need to train a local doctor as well in this country, or the chapter is perfect there?
No, we have to train the people, we have to train the diabetes physicians, diabetes nurses, because diabetes is a full-fledged specialty. The normal doctor cannot treat diabetes as a diabetician can treat. So we have to give awareness, we have to educate the health sector first, that what are the investigation, diagnostic and therapeutic options available.
Is it true that sugar increase the diabetes or no? Or that's a lie,
Of
which we
course.
grow up.
It's a complex,
Sugar mean, you know, which we
these,
put in tea,
yeah.
you know, that's what.
Diabetes is not a disease, it's a lifestyle. So decreased activity, increase intake of carbohydrates and of course having no exercise is the cause of diabetes. But if you don't take care of your diet, you don't do exercises regularly, so even if you don't take sugar, again you will be having diabetes. So it's a complex process and it needs years to explain, but we should educate the people, and I will request to this media that till the time we are here, you should get treated by a qualified and professional doctor.
What do you recommend as a simple human being who is not a boxer or wrestler, who is not a boxer or wrestler or something, like not who don't go to the gym? What do you recommend that he should walk? How many kilometer or what is the percentage?
In medical language, we say like this: if you use balanced diet, you will not get any disease. About the walk, if you can walk for 15 to 20 minutes, simple brisk walk, 5 times or 6 times a week, it will be as useful for you as you are doing some aerobic exercises. And of course, you have to prevent the disease by preventive measures.
So, I would like to ask some few technical questions regarding diabetes. Our Pakistani doctor, he is specialized in diabetes and diabetes-related complications. You have mentioned that you aim to collaborate with the Ugandan health sector. So, I mean, if Ugandan Ministry of Health would wish to collaborate with you, most especially when it comes to diabetes, how welcoming it is from Pakistan Healthcare Foundation?
Of course, it is very possible, and I will suggest, and I have even talked to the Uganda Medical and Dental Council people also, that first of all, we should have, just like we have Diabetes Foundation in Pakistan, in Europe, and everywhere. So we should have diabetes foundations, diabetes societies, in which we should invite the qualified people, and then they can train more people. It takes about 3 to 4 weeks for the nurses to get trained, 2 to 4 months again for the physicians to get trained. And I will request that the government of Uganda, Health Ministry of Uganda, should encourage experts to come easily, and they should encourage to come from the Europe, India, Pakistan, and they shouldn't be having ban or so many boundaries as we face here, and they should be permitted to work freely.
So, my next question would be that yes, of course, you have mentioned that the level of understanding of diabetes, it's a progressive disease. What do you think? Why is it that Pakistani doctors are more specialized when it comes to diabetes as compared to Ugandan doctors?
Of course, we have developed institutions, and we have developed pharmaceutical industries, and we have collaboration with the Royal College of Physicians and College of Physician Surgeons in Pakistan. And Ugandan people are also very hardworking and intelligent, but they have to explore the opportunities. They should import the talent, and they should go to the countries where they can equip themselves with good knowledge and professionalism.
Thank you very
So
much.
the guys, what I realize, another thing, that Uganda is still a baby for that kind of sickness. 20% according to the doctor. But it will increase if we don't work out today. How do you see?
It's a great pleasure that we have Dr. Abid with us here, a kind of, let's say, specialist on diabetic and other things. I just wanted to ask one thing. I feel like when someone is fat, he might be having more chances. Or my question is, at what age, as a specialist, you recommend that a person should come for regular tests? Which age? I think you have more experience. than what
Actually,
Only for sugar or everything?
no, I'm asking about diabetic. Just
Diabetes.
diabetes, there are 2 types, type 1, type 2. Type 1 is since birth. If your parents are diabetic, so the baby born may be having diabetes since
That's we
birth.
call it
That
MOSI,
is type 1 diabetes. And type 2 is that is after 30 years of age. And again, then risk factors are anybody who is obese, doing no exercises, and taking a lot of carbohydrate diet. So normally in medical language, every individual should get medical screening in 3 months. But if you develop some symptoms, and you should be then worried about your health, and you should go to the nearby physician. And you should discourage going to quacks and these normal dispensers, as they don't know. Even I am telling my people that even the normal physician cannot treat diabetes in the professional way as a dietitian can do. Because in medical language, if you are not qualified for some portion of disease or professionalism, you should refer the patient to the concerned one. And every individual should screen and then get tested whenever either there is some symptom or he has a family history.
I think that's it.
Okay, the guys, what is Dr. Abid is the very qualified doctor from the Pakistan Army, and now he's serving to Uganda as well. And now, and very big pleasure for us that he's with us. And secondly, this is the platform which I have organized, and I got a very big time family in this country as well through my social media. I love to say thank you everybody, and my pleasure is one, that I will open a door for everybody in this country, for every department, and free of cost. I'm not that kind of person who love money from the social media to make my own subjects on high position and people fairly not to get the knowledge. This platform will give you the knowledge. Yeah, though I am very happy that such a kind of doctor, we need them in this country. Reason, today as I said, we are in small for that kind of sickness. If we don't control, it will increase more and more. Thank you very much everybody who is with us. Thank you very much doctor, and salam to Pakistan, salam to Uganda.
Thank you.